refer them, because this will need a laser treatment. This will need especially laser treatment around the fovea, as well as fundus fluorescent angiography, provided they'll need anti-VEGF injections as well. So again, these are all abnormal blood vessels now. There you can see the abnormal new vessels disc. So these patients will need urgent treatment, so urgent referral is required. There again, new vessels elsewhere. So it's these are all proliferative diabetic retinopathy. There again, NVE, NVD, all distortion of the blood vessels, is better to refer them immediately. So now is the, so these, and again, many of them, they present at this late stage. You see, this is proliferative diabetic retinopathy with extensive vitreous hemorrhage, so we can't do much about this unless the patient needs to go for the surgery. There, this is also, it's bleeding from new vessels somewhere else, so this will need immediate treatment. So abnormal blood vessels. So these are all advanced stages of diabetic retinopathy needing urgent treatment and referral. So, and many of them, nearly 1/3 of the patient in our country comes at this late stage. So when there is complete fibrosis, the patient, the vision will be counting finger, you know, we can't do much about this. So clinically significant macular edema, patient will have central distortion. So these are the grading of, so when there's macular edema, 1 disc diameter within the 1500, within 1 disc diameter area. So this is the grading of the macular edema. Clinically significant macular edema, they will need immediate anti-VEGF treatment. There again, you see these are hard exudates, dot and blot hemorrhages focused on the fovea, and they will need immediate treatment. So this is, again, we find, diabetes is one of the most commonest condition right now, and hypertension is not uncommon as well. It's very, very common. So these are the gradings, so grade 1, grade 2. So up to grade 1 and grade 2, you can easily see them, observe, follow up. But once it goes into the grade 3 or grade 4, which is the malignant condition, it's better to refer to them. Like, so you see these are hard exudates, flame-shaped hemorrhages, cotton wool spots. There are, the exudates on the fovea as well, and in the malignant hypertension or in the grade 4, what happens? There is complete disc edema. So in that instance, they will need not only ophthalmologist to review, it needs to be referred to the physician for immediate lowering of the blood pressure and further management. So you will see all these patients as well with the central retinal vein occlusion. Disc edema, dot hemorrhages all around, all dilated tortuous vessels, and patient will have complete loss of, sudden loss of vision. So if you do fundus angiogram, you see these are all non-perfused retina there. So this will need treatment by either anti-VEGF treatment or by the pan-retinal photocoagulation. This needs to be referred. So again, another very common, this is again very common condition in our country. This is branch retinal vein occlusion when one of the quadrant is involved by retinal hemorrhages. So this is the superotemporal vein occlusion, and this is the inferotemporal vein occlusion. Look at the kind of ischemia you have by fluorescent angiography. There's more than 10 disc diameter. This is this can lead to neovascular glaucoma when it develops new vessel ischemic changes, new vessels, and finally into the glaucoma. So then this needs either anti-VEGF treatment and laser, so it needs to be referred again. So central retinal artery occlusion, sudden loss of vision, you see all edematous retina with cherry red spot on the fovea. There, this is again the retinal edema with the sparing of central, this is the cilious retinal artery sparing. So this again, this is the emergency condition of the eye. So this needs to be referred immediately. So you will come across with these conditions as well. Involvement of one eye, distortion of the central vision. This is the central serous retinopathy fluid. Angiography shows the leakage, and optical coherence tomography, subretinal fluid, PED. So you can treat them with, observe. In fact, they don't need treatment. Usually this will resolve within 3 months. You can treat them with anti-inflammatory and counsel, because this happens in the most anxious patient, counseling about anxiety, other risk factors, and then follow up within 3 months, and if it doesn't resolve, then refer them. So again, very common. We do see less compared to the West. There's wet age-related macular degeneration. There's a bleeding, there's a complete RPE changes there, and if you do fundus fluorescent angiography, there's a leakage. So this will need immediate treatment by anti-VEGF. Dry age-related macular degeneration also, you see there's plenty of drusens. So fundus fluorescent, there's no obvious leakage, but these are all staining. So these patients can be followed up with counseling, with their diet counseling, avoid smoking, and give AMSLA chart to them to reassess by themselves, and if there is any changes, then refer them immediately. So this will also, like when you do the fundus photograph, and you sometimes, this is the accidental finding, this is the choroidal nevis. You see the pigmented retina, pigmented part, and this is the blocked fluorescence. This, it can be observed. Take series of fundus photograph, and if increases in size, then refer them. But then this will need immediate referral. You see, there's a mass there, yellowish, greenish, the elevated mass. Angiogram shows the initial blockage, and there is hyperfluorescence at the late stage. This is the choroidal melanoma. So this is both life-saving as well as the vision-saving if you refer them immediately. So it's very important. So finally, optometrists have a very crucial role in eye care services. They can be a leader, as from the previous speaker, she has explained everything so well. So in fact, they can be the first contact person in diagnosing many retinal diseases, and they can be the best counselor, and very important role in telemedicine. So with this, I would like to, this I've taken from the magazine, from the journal. So I was first year resident while this is the first batch of IM. This is the residence, this is the Pooja, Prakash, am I right? Santosh? This is the first batch, and in fact, I was also involved in teaching basic to this first and second batch. See, these are all pioneers now. Jyoti, where is Jyoti? He is the pioneer in vision-related quality of life in Australia, Melbourne. He's doing very well. Gauri, he is one of the most important tutor in, the associate professor in IM. Santosh, right? So these are the role models. So they are doing excellent, brilliant in their field, and you should follow their path. And another one is, I know up to this, so you know him very well, Sanjeev Misra, so he is the president. So again, as a leader, as an advocate, they have a very good, important role. And I should thank Dr. Suras, where is this? Who is the main guide for the few batches, I think. And she, along with Bob, Dr. Shashank, Dr. Jeevan, they are the main people to create the history of optometry in Nepal. And today, we've got a news that optometry is starting in Himalayan Eye Hospital as well. So, the role of optometry is very important, because there are hardly any, there are just 300 ophthalmologists till now. So there is a huge gap in providing eye services for all the people. Thank you.
Thank you, ma'am, for putting the lights on the role of optometry. I would like to call upon Gyan Bahadur Basnit, Secretary of Nepalese Association of Optometrists, to hand over our token of love to Eli, ma'am. Also, I would like to request him to hand over our token of love to Hassan Minto,